Hi, everyone. My name is Lynn Cordo for OM Media Group. Thank you for joining us for the first installment of our series, Improving Mental Health Access in America. This event is brought to you by Providence St. Joseph Health, and we are thrilled to be addressing such an important topic. As a reminder, please share the link of this event right now on your Facebook page so we can invite more people to attend and share the knowledge that we will be gaining from our expert speaker. Mental health is an issue that affects us all. Many of you in my community are familiar with some of the challenges that some of our friends have faced, and as such, you know, this issue is really near and dear to us. For everyone else, whether directly or indirectly, today's resources could be very useful to someone you know, so please help us share the link. Tonight, I am thrilled to welcome our guest speaker, Dr. Arpan Wagre. He is the Chief Medical Officer of Wellbeing Trust, a foundation of Providence St. Joseph Health. Welcome, Dr. Wagre. It's such a pleasure to have you.
Well, thank you so much for having me and having this very important discussion today.
We're so glad you're here. For everyone watching, a reminder that the information provided during this event is for educational purposes only. It is not intended nor implied to be a substitute for professional medical advice. The participant should always consult his or her healthcare provider to determine the appropriateness of the information for their own situation, or if they have any questions regarding a medical condition or treatment plan. Participating in this event with this clinician does not create a physician-patient relationship. Please post any specific questions here for Dr. Wagre, and we will aim to get all of them, if not most of them, answered by the end of the evening, certainly within the next 24 hours. So please put your questions up. Dr. Wagre, if we can get started, can you tell me a little bit about who Providence St. Joseph Health is and what they're doing to improve mental health?
Sure. Providence St. Joseph Health is one of the largest health systems in the country. We're across 7 states and have 50 hospitals, over 800 clinics, and are dedicated to improving the health and well-being of every patient we serve in our communities, and particularly improving the health and well-being of our poor and vulnerable. And so when Providence and St. Joseph Health came together, they did not want to just come together for the sake of becoming bigger, but to advance an important social cause. And that was advancing mental, social, and spiritual wellness nationally. So there was in Wellbeing Trust, which is a national foundation that was created with an initial endowment of $130 million. And the focus of Wellbeing Trust is to do a lot of different things for our, communities as well as for our patients. And improving access to mental health care is a very important part of this. Building resilience in children, teens, families is an important area of focus. Decreasing suffering from depression and anxiety, as well as decreasing addiction, but instilling hope in families and patients with severe mental illness while eliminating stigma everywhere. So that's our primary focus areas and the reason we came together.
That's awesome. In your estimation, what percentage of Americans do you think are with mental health issues today?
So mental illness is a very prevalent condition. It's very common. 1 in 5 adults in the United States, that's about 43.8 million adults, will experience some mental illness related issue in a year. Depression, for example, is the leading cause of disability worldwide. So these are very prevalent, very common conditions, and a lot of people are affected by mental illness, either themselves, through a loved one or friend or someone they know. So this touches every one of us.
I agree 100%. I think we all know somebody who suffers from some type of mental illness. What Can you tell us a little bit about what telepsychiatry is and how it works?
Sure, sure. So telepsychiatry, telemedicine is the use of technology to provide care from a distance. So this usually leverages video conferencing. And when we say psychiatry, we mean all kinds of psychiatric services. So a diagnostic assessment, medication management, therapy, all these kinds of treatments can be provided using video conferencing. And psychiatry, being a highly cognitive discipline, lends itself naturally to this technology. So that is what we mean by telepsychiatry.
Incredible. Um, who would benefit from this innovative approach to psychiatric care?
So that is a good question. Most patients with most common psychiatric conditions could benefit from care delivered via telehealth. Now, there are some patients who particularly would benefit from this use. So, for example, children with autism spectrum disorder who are very comfortable in their home setting. And it's really hard for them to go to a clinic, and the families around there, it's much easier for them to receive care via telehealth at home. Patients with severe debilitating anxiety, when it's hard for them to leave their house, it's much easier for care to be delivered to them at home. Patients who are elderly and homebound, people who live in rural settings where there is no access to care, very limited access to care. And also, telepsychiatry can be delivered in various care settings. So you could receive the care at home. Telepsychiatry could be used in emergency departments where there are no psychiatrists available, medical floors, jails, nursing homes, schools. So in most settings, this technology could be used to deliver care. But then it's also important to think about it. Like, we have historically designed our care around the provider experience. But what we really need to do is think about designing our care around the experience of the patient and their family members. So if you had to receive, psychiatric care or therapy, why do you have to take a day off from work and drive to, a place that's 30, 45 minutes away in the middle of your day to receive, cognitive behavioral therapy on a weekly basis, when the care could be designed around your comfort, in the comfort of your home or whatever setting you choose. That eliminates stigma. It makes it so much easier for people to receive care. And then, there's another side to it as well. There are, I'll give you an example: patients with severe postpartum depression. So, by the way, postpartum depression is the most common complication of childbearing, so a very prevalent condition. But think about it. You have a new mom who's suffering from severe depression as a 6-week-old baby, is feeling guilty for feeling depressed. The stigma prevents her from receiving care. And now we expect that she somehow, although she, as though she does not have enough on her plate, has to figure out childcare, has to figure out everything, and come to the therapist's office for weekly cognitive behavioral therapy. Just think about it. If this and if they're non-compliant, we wonder why they're non-compliant, and we say you're non-compliant. But the reality is that we need to design the care around the experience of the patient and their family members. And so we need to take the care to this person in the comfort of her house to get the right kind of care. And that is really what the future of telehealth is going to be. It's going to be around designing care models around the experience of patients, family members, and making care easily accessible in a timely manner. So that's the promise that telepsychiatry holds for care.
That's great. I think that is such a compassionate approach, accessible, and just opens it up to so many more people. Will this be something that's available nationwide?
So yes, it is. I mean, it's interestingly, telepsychiatry has been around since the 50s and 60s. It gained. I mean, technology was more expensive, so gained more adoption in the late 80s, early 90s, more so in Australia earlier on in the 90s. And then over the years, now that technology is so much better, it's used in a lot of settings, almost all over the country. So it is available. There are many telepsychiatry companies that provide care to patients in hospital settings and at home. So it's very much available in most parts of the country and the world, I would say.
Awesome. Just a reminder to our audience for everyone to share the Facebook link so others can join us. This is a really important conversation and we don't want anybody to miss out. Doctor, what are some of the things you can treat, and is there anything you can't treat through this delivery system?
So telepsychiatry is comparable to in-person care for almost all psychiatric conditions. So there's been a lot of research, almost about 70 really good randomized control studies that demonstrate that the diagnostic validity, the therapeutic relationship, the clinical outcomes for almost all conditions, depression, anxiety, even schizophrenic illnesses, bipolar illnesses, is comparable to in-person care. So that's something that people need to be aware of, that it's the same. You can use this technology to provide care to most conditions. Now, of course, the patient preference is an important thing. And if somebody does not want to use technology for whatever reason, that's an absolutely valid reason not to use it. So obtaining people's consent and making sure that they're comfortable with this. Now, there are some limitations. If you had to say do a physical examination on somebody who you started certain psychiatric medications on, and they might have some side effects. So that is a limitation. You can't smell alcohol on people's breath, and there are things that you would normally pay attention to when you're in person in the clinic. Now, what we have done though is in clinic settings, hospitals, emergency departments where we use telehealth, we utilize the help of a trained nurse who functions as a telepresenter, and they're very skilled and very well trained, and they can assist with all these things, including the physical examination, certain things that need to be done. In elderly patients, if you needed to do some cognitive testing and have like a memory test or clock drawing test or something, they could do that, and telepresenters frequently do this for us.
It's just incredible technology. Do you feel this is a treatment for crisis situations? Can it be used for crisis situations?
Yes. However, I do want to point out that there are several situations, psychiatric conditions, when people are in an acute crisis, say active suicidality or extreme, florid psychosis, where they would need to be served in a structured, supervised inpatient psychiatric setting. So definitely want to make sure that we're calling that out, that if somebody needs to be in a hospital, or then that's the appropriate care setting. But when you think about it, a lot of the psychiatric, a crisis in the psychiatric situation can be averted by providing timely access to good care. And so if somebody is depressed and they're withdrawn and they're not taking their medications and they're just not well enough to go and receive care, if care is brought to them in the comfort of their home via telehealth, we would hopefully be able to intervene sooner before it becomes a full-blown crisis that they need to be taken to an emergency room or hospital. So the short answer is yes, it definitely could be used in a crisis situation, but we do need to be aware that there are times when people need to be in the hospital, and that's the appropriate care setting for them. And so we need to pay attention to that as well.
Absolutely. Do you can providers prescribe medication through this service?
Absolutely. In fact, most medications are prescribed electronically through patients' pharmacies. So this is like I said before, there's tons of research, and the American Psychiatric Association does back the use of telepsychiatry for care. And this is something that they see as an appropriate method of delivering care. So it's very similar to what you would do in an office visit. So you could see people, do a diagnostic assessment, get a good history, and then you determine that they need medications. You discuss the risks, benefits of the medications, and you can electronically prescribe them to the pharmacy. Now, there are some controlled substances where there are some regulations that you have to be aware of. So you could still prescribe controlled substances, but there are some requirements, including needing to have a in-person visit every 24 months for some patients who are on controlled substances. So yes, we definitely prescribe medications via this technology.
Wow, that's incredible. What about confidentiality and security? Is it recorded? How does that work?
So that's an important question. That comes up quite a bit when we're speaking with patients, and understandably so. I mean, look around us and see all kinds of data breach that happens, and so we are held to very high standards in using telepsychiatry. So you have to use a HIPAA compliant platform. So that is the Health Information Portability and Affordability Act, by which that's the standard that we're all held to, that requires a certain secure platform. So we just don't use Skype or something else. You do use a secure platform. There are also federal encryption standards that we have to follow. So the technology we use is compatible with all those things and meets all those requirements. So it is very safe, it is very secure, and most telepsychiatry is delivered via bidirectional video session, just like we're talking right now. And it's not recorded. Now, there are some use cases where with previous informed consent, patients are made aware, and there's a store and forward kind of methodology where there's somebody who's assessing the patient, they're recording it with the patient's permission to be shared with the care team so that they're able to help in that patient's care. But most of what we do in telepsychiatry is a bidirectional video session, very similar, again, to the kind of care that you would receive in an office or in an ER or hospital with the patient and the doctor. So it is not recorded, it is safe, it is secure. I do want to call out, though, that there is, while we have talked a lot about using technology to deliver care, as a patient directly from the physician to the patient, this platform and the technology also provides an opportunity for us to deliver newer, more effective models of care. So think about it. If you had to see your primary care physician whom you trust and you work with them and you have a great relationship with them, and they are able to help you with your depression management and they feel that that's what's going on, but they want a consult. They want some expert in the field to be able to weigh in and kind of work with them, but they're going to be managing that patient's care. So wouldn't it be so much more comfortable for the patient to have a joint visit with their primary care physician using this technology? So that is one example. There's several other situations. There are models of care like Project Echo that was developed out of University of New Mexico, where what you have is a care team, and you have a multidisciplinary care team that's discussing cases and disseminating knowledge, helping primary care physicians in rural settings to be able to provide the highest quality of evidence-based care. And it's a process of continuous learning, but the technology is a platform. And yes, it helps us provide services when, care is inaccessible in a rural setting. It allows for some convenience in people's home. It allows us to provide services in various settings, but also the opportunity for the future is really astounding when you think about it. There's so many things. You think about the use of a cell phone. I mean, people, it's so ubiquitous, more than drinking water. I mean, an average person has 70 clicks and about 2,600 touches on their iPhone every day. So we use those devices; they're a part of us, and being able to deliver care through that and monitoring people proactively. The opportunities using telehealth to really improve the health and well-being are just so prominent that we need to pay attention to this, and we need to start thinking outside the box and start designing care with that patient experience and patient and family member in their mind, and using technology to meet whatever their needs are.
That's incredible. And I think you touched on it a little bit when we talk about the technology aspect of it. So this is something that would then be available, whether it's through something like we're doing now, where we're speaking to each other via computer or laptop, or it's mobile, any type of connected device then. Is that true?
Yes, so absolutely. But like I said before, I mean, it needs to be HIPAA compliant and a secure platform to make sure that that confidentiality is maintained. Providence, St. Joseph, we have telepsychiatry that we deliver right now in about 15 rural critical access emergency departments and hospitals in California as well as Eastern Washington, and we're expanding our services to various care settings. We have, we will be soon expanding services to people at home, and there are platforms that could be used. Technology is available, and you can send a secure link to a patient. They can open that, and you can authenticate, use two methods of authentication, and then you could provide care to them in their home safely. So yes, I mean, the technology is available. It's readily available, and there's so many different ways in which you can use this.
And in terms of convenience, I was just wondering for myself if to do a televisit, is it approximately the same length as an in-person visit, or does it differ in any way in terms of length?
So it's very comparable to in-person visits. So typically, depending on what the clinical need is, most initial psychiatric evaluations are about an hour long because there's history that needs to be collected, and the mental status is done, and diagnosis is discussed, treatment plan is discussed. Follow-up visits can vary in their length depending on what the clinical needs are. But the technology does not slow you down. I mean, there are some situations where you would like to be able to get more background information. So suppose we're using telepsychiatry to see a patient in a remote rural emergency department. We need to spend some time to familiarize ourselves with what the local resources and community resources are, because that helps us in our decision making. So sometimes those kind of things, or collecting collateral information from family, might take some time, especially when you're not very familiar with the care setting and you don't know everyone. But by and large, the time that the visit takes is pretty much the same, whether it's via telehealth or whether it's in person.
Just the convenience of it is amazing, because I feel like in person situations where sometimes you may have to wait 24 to 48 hours for a physician to come to see you, this is just so much more convenient and immediate, wouldn't you say?
Absolutely, absolutely. I mean, again, going back to what we spoke about earlier, I mean, a lot of what we've done was based on the provider convenience, and yes, we want everyone to, we want providers to be satisfied with their work, but I think most providers want to be able to provide easy and quick access to their patients and help them when they really need them. And if technology can help with that, then so be it. There are on-demand services. There's planned visits. So if people are concerned that you're always going to see a different provider, that's not necessarily the case. So you could have that therapeutic relationship, and you can continue to see your provider on a planned, scheduled basis in an office setting or at home. But then if you're in a crisis, in an emergency room, you could also have on-demand services where 24/7 you could be seen by a board-certified psychiatrist, start treatment sooner, and get the help that you need. So there are a lot of different advantages. And going back to what we believe at Providence St. Joseph, which is very core to who we are, which is everything that we're doing is with the patient and their family member at the heart of it. And our care models absolutely need to be designed with that in mind. And that's who we are, and that's what we're about.
That's awesome. That's what makes you guys so great. What about insurance? Is this covered by insurance?
So yeah, that is a question that comes up quite a bit. It has been, there are some barriers. So right now there are 32 states where there's legislation passed where private insurers are mandated to cover telepsychiatry, just like they would in-person visits. Medicare does cover these services in what they consider healthcare shortage areas. Medicaid also covers it in 48 states, but in different, there's certain rules that are followed. It is changing. I mean, right now, in-home services are still not reimbursed very well. There are some limitations in this, and I think that is being addressed. The other thing that does happen is, just to be clear, like, so where the patient is, so suppose there's a provider who lives out of state, that provider, where the patient lives is where the service is provided. So they need to be licensed in that state where the patient lives. So that making sure the licensure is appropriate. So physicians need to be licensed in states where they're practicing, where the patient essentially lives. There's credentialing. And so those things sometimes have slowed the use of it. But I think there's a lot of progress that's being made. And they're sharing agreements now with credentialing and licensure across different states. So it is getting so much better.
This has been a great conversation. You've given us so much amazing information, and we're so excited about the programs that you provide. We're very grateful to Dr. Wagre for joining us this evening, for making time to share your insights with us. We're so thankful. For all of you who joined us, check out Providence St. Joe Health's website at future.psjhealth.org. And again, Dr. Wagre, thank you so much for joining us, for your time and your insight. We're so grateful. And for everybody watching, please visit the website and get more information about this very important topic. Thanks, everyone, for joining us.
Everyone for joining.